Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Today, we shall be talking about what is SLE with emphasis on lupus kidney. The SLE is an acronym for Systemic Lupus Erythematosus. It is an autoimmune problem. What we mean by autoimmune problem is problem that affects self organ. The body is attacking itself. And now, the situation is such that it can attack all the systems of the body and all the organs of the body. So it's a very serious problem that has been discovered so many years back. But the ones I want to lay my emphasis on is on the one that affect the kidney itself, where you find the kidney now making people to swollen up. The all parts is swollen with water because the kidney has been damaged, and the water is now everywhere in the body, that when you press the person, the person looks so big, but by the time you press the skin, you start seeing that the pressure you apply causes depression of that skin, and it is even affecting the face anywhere you press. The end result is it increase the blood pressure and so many other complications. The treatment I shall also talk a little on, since it's not my area of specialization, but the recommendations given will only be mentioned. The laboratory aspects, which is my area of specialization, will be dwelt upon to let us know how we can really diagnose lupus kidney, so that the problem will be nipped in the bud. There are also other tests that can be used as a screening test to nip this SLE in the bud, the lupus kidney especially. So if you like my presentation, press the like button, subscribe, and join me on the slide session. The outline: objective introduction, signs and symptoms, lab diagnosis, prevention or treatment are what I shall be talking about. The objective: to create the necessary awareness of systemic lupus erythematosus, also called lupus disease, in order to expose the risk factors and laboratory findings that are helpful in its treatment. The introduction: systemic lupus erythematosus is a difficult condition to understand, but the terminology SLE is easy to understand as a disorder that affects all the system. X standing for system, multi-system. L, lupus, is a disease that occurs when your body immune system attacks your own tissues and organs. Autoimmune disease, whereas the E stands for erythematosus, means reddish, inflamed. Inflammation caused by lupus can affect many different body systems, including your joints, skin, kidney, blood cells, brain, heart, and lungs, etc. As Grape described the lupus erythematosus LE cells in 1948, displaying it just like I showed here, several pathogenic autoantibodies have also since been identified. The American College of Rheumatology and Systemic Lupus International Collaborating Clinic have, because the LE cells that were formerly thought to be specific have been found to be non-specific for SLE, and so rule it out that both the clinical and laboratory findings are now to be used, and there are 11 criteria requiring 4 out of these 11 to confirm that somebody has SLE. The global rates of SLE are approximately 20 to 70 per 100,000 people in female. The rate is highest between 45 and 64. You could experience SLE from 15 years, even up to 40 years of age. It affects more female than male, 9-1, ratio 9-1. The lowest overall rate exists in Iceland and Japan. The global prevalence, according to Google, of systemic lupus erythematosus is estimated to be 43.7 per 100,000 people, affecting approximately 3.41 million individuals. The incidence rate is around 5 to 5.14 cases per 100,000 persons per year. Prevalence and incidence rate vary globally, with higher rates observed in certain regions and populations, especially in the black skin, Asia and Africa. Global prevalence 43.7 per 100,000 persons. Global incidence is 5.14. Affected population approximately 3.41 million people worldwide. So it shows that it should be even a public concern, because it is not something that is rare with this kind of prevalence in the 100,000 people. And there are areas of the world where it is higher than even that prevalent rate displayed there. Yeah, one important information one must not fail to mention is the pregnancy complication. We know that it is 9-1, the prevalence of this SLE. So the implication in abortion and spontaneous abortion and stillbirth is very necessary, and the immune antibody plays their vital role, and that you can easily be detected. So SLE patients with positive antiphospholipid antibodies are at a high risk of spontaneous abortion and fetal loss, preeclampsia, and maternal thrombosis. So there are certain tests that you would usually do, and these are listed, including the rhesus antibody. The risk is 2% with first pregnancy, but increases to 20% if there is history of neonatal lupus in a past pregnancy. Signs and symptoms. Yeah, for a prevalent disease like this, one should, especially when the symptoms are almost alike, other problems, conditions that are bound, one should try and memorize these signs and symptoms. Swelling, usually in the feet, ankle, legs, that's what is displayed. Foamy urine, peeing more often than usual, especially at night. That's common. High blood pressure. Symptoms include fatigue, fever, joint pain, and a butterfly-shaped rash, as seen there. Mala, as shown. Discoid rashes, scary alopecia, mouth ulcer, skin ulcer, and photosensitivity. That is when you now ascribe these reactions to the sunlight. That's why they call it photosensitivity. The laboratory diagnosis. Yes, talking generally, blood tests are used, especially, Cecilia mentioned, antiphospholipid syndrome test involves checking for the presence of specific antibodies in the blood that are associated with the condition. These tests typically include measurement for the PDR, the anticardiolipin, lupus, anticoagulants, and anti-beta-2 glycoprotein 1 antibodies. A diagnosis of APS usually requires positive results for at least one of these tests on two separate occasions, at least 12 weeks apart. Then when we really want to talk about lupus nephritis, there are samples usually collected. It's also blood, urine, and you want to do biopsy. The urine especially, you look out for the appearance of the urine, whether it's foamy. Then the protein, you also look out for blood in the urine, because it presents with protein, hematuria. And also, you also want to test the small kidney portion, that is the biopsy taken, and then examine, do the histology slide and examine for the early, typical cells that would show that the kidney is damaged. The LE cells too will also appear, especially in the clotted venous blood, the peroneized bone marrow. These are all going to the factors and donor cells all checked on. Finally, prevention and treatment. When we talk about prevention, let's look at the risk factors. That is just like telling us, look at the risk factors, which, if avoided, are key to preventing the disease. Some risk factors are unavoidable, like age, except we can stop aging. Unfortunately, lupus can't be prevented, cannot be prevented, but we can slow it down and avoid things that triggers it. Risk factors include lupus is influenced by genetics, hormones, potentially environmental factors like sunlight and certain medications. So managing flare-ups by avoiding triggers too. The triggers could be sunlight, stress, and certain medication can trigger lupus flare-ups. Avoiding this trigger is crucial. So management of that, making sure you don't get so triggered. You have to protect your skin, not moving into intense sunlight. That is what is called photosensitivity, as drawn in this diagram here, in the photo. Stress, you do exercises, mild exercises to lower your stress. Just make sure you take your mind off these stressful things as well. Also, it might interest us to know that some researchers have found that secondary stage signs and symptoms of syphilis is very similar to SLE. And they found out also that treatment with penicillin at that stage, chloroquine, and non-steroidal anti-inflammatory drugs resulted in cure and not progressing any further to SLE. So these should be very handy. In addition, women are at 10 times more risk of developing SLE than men, and the risk of SLE is 14 times more in Klinefelter syndrome, which suggests that there is an association with the X chromosome. So female sex and hormonal influence are significant risk factors for SLE. Estrogen, prolactin promoting autoimmunity increase the B cells activation factor production and modulate lymphocytes and plasmacytoid dendritic cells activation. The use of estrogen-containing contraceptives and postmenopausal hormones replacement therapy can cause flare in patients with SLE and have been associated with a higher incidence of SLE. Whereas androgens, on the other hand, are immunosuppressive, showing clearly that the ratio of 9:1 that we see is more of that sex hormone. Treatments are focused on the immunosuppressants, the anti-inflammatory drugs, as well as balanced diet amongst and also the pain relievers, so that the person can live a normal life with less stress. So if you like what you have watched, there are many more videos for you to watch. You can always press the like button and subscribe so that more you are informed immediately there is a new production. So hang on as more and more will be revealed.